के संस्कार पीढ़ी दर पीढ़ी चले आते हैं। गुरु को याद करना एक दिन का काम नहीं, गुरु तो वो है जिसे हम रोज़ अपने व्यवहार, अपनी सेवा और अपने रोगी के साथ निभाते हैं। आज गुरु स्मरण के माध्यम से हम उनकी परंपरा को प्रणाम करते हैं। गुरु का दीपक कभी बुझता नहीं है।
तीर्थ के दर्शन से तो हम सबको आनंद मिलता ही है, पर सिर्फ तीर्थ की प्रशंसा सुनने पर भी हम कितने आनंदमय हो जाते हैं। तो ऐसे चैतन्यमय मानव तीर्थ गुरुवर्य प्रभाकर तानाजी जोशी, जिसके बारे में मैंने अपने गुरु वैद्य सतीश भट्टार सर के पास से जो भी सीखा है, जो जाना है, उसके बारे में गुरु स्मरण के रूप में आपके सामने प्रस्तुत करूंगी। आज हमारे सबके दिल में उनके प्रति इतना प्रेम, उनका इतना ज्ञान कैसे है? क्योंकि उनकी एक इच्छा थी, पुत्रात् शिष्यात् इच्छेत् पराजयम्। वो अपने शिष्यों को उनसे आगे देखना पसंद करते थे, इसीलिए उन्होंने अपने पूरा ज्ञान सब में बांटा, पंचकर्म का इतना प्रसार किया। पर इतना बारीकाई से, इतना सूक्ष्मता से, इतना गहरा ज्ञान उनको कैसे है? उनके गुरुजी बताते थे कि सिर्फ ग्रंथ को पढ़ना, कंठस्थ करना वो इम्पोर्टेंट नहीं है, उससे भी इम्पोर्टेंट है उसको स्वयं पर अनुभव करना, क्योंकि स्वयं मरे बिना तो स्वर्ग भी कहाँ है। उदारता और सरलता तो उनमें बहुत झलक के दिखाई देती थी। उनके दिल में गरीबों के लिए बहुत करुणा थी। कई बार तो ऐसा हुआ है कि उन्होंने मुफ्त में चिकित्सा की है। और तो और आयुर्वेद कर्म की अवस्था को बारीकाई से समझकर उनको प्रयोग करके काफ़ी मरीजों की जान बचाई है। और इसी के साथ उनको कोई घमंड नहीं था और ना तो पैसों से लगा। टीबी का पेशेंट ठीक होते हुए 1 लाख रुपए का चेक मिला और वो चेक उन्होंने नगर परिषद के नाम अपने आध्यात्मिक गुरु जो श्रीरामपुर के स्थित आश्रम में है, अपने आध्यात्मिक गुरु जो श्रीरामपुर के स्थित आश्रम में है, उनकी बहुत सेवा करी है। और एक अन्य उदाहरण उनके गुरु भक्ति का, उनके आयुर्वेद गुरु को अवार्ड न मिलने पर और उनको अवार्ड पर इनवाइट करने पर उन्होंने कहा कि मेरे गुरु से पहले मैं अवार्ड कैसे ले सकता हूँ। मतलब देखिए उनकी गुरु भक्ति। ये आयुर्वेद के शास्त्र सिवाय अन्य शास्त्रों का भी उनको बहुत ज्ञान था, बहुत सारी तो उनमें कलाएं थी, इतनी सादगी।
पंचकर्म शिरोमणी आयुर्वेद महर्षी आदरणीय वैद्यराज पीटी जोशी म्हणजेच आपले नानाजी, जन्म 5 जानेवारी 1936 चा, गरीब घर, मेथी विखरणच्या मातीतील सौंदर्य, हातात शेतीची ताकद आणि डोळ्यात आयुर्वेदाची सेवा. वैद्यराज टी.एम. गोगटे यांचं मार्गदर्शन आणि नाशिकचं आयुर्वेद शिक्षण. धुळ्याच्या नगरपालिका रुग्णालयात त्यांच्या टीबी संशोधनानं संपूर्ण देश थक्क झाला. अशक्य वाटणाऱ्या एमडीआर टीबी रुग्णांचे प्राण वाचले. 10,000हून अधिक विद्यार्थ्यांना पंचकर्माचं प्रशिक्षण देणारा गुरु ते नेहमी म्हणायचे, बस्ती द्यावा, बस्ती घ्यावा, बस्ती जीवाचा विसावा. शेकडो शिबिरे, हजारो रुग्ण, लाखो आशीर्वाद हेच त्यांचं खरं वैभव. नाना या जगात नाहीत, पण गुरुस्मरण सोहळ्याच्या रूपानं आज प्रत्येक श्वासात त्यांची उपस्थिती जाणवते.
पंचकर्म महर्षि वैद्य पीटी जोशी आयुर्वेद के महान चिकित्सक, गुरु एवं समाज सेवी थे। उन्होंने आयुर्वेद को केवल चिकित्सा पद्धति नहीं बल्कि मानव सेवा का माध्यम माना। उन्होंने पंचकर्म चिकित्सा को सरल, प्रभावी एवं सुलभ बनाकर सामान्य जन तक पहुंचाया। त्वचा रोग, स्नायु विकार, रीढ़ संबंधित रोग तथा कुष्ठ रोग जैसे दीर्घकालीन रोग में उनका योगदान अत्यंत महत्वपूर्ण रहा। वैद्य पीटी जोशी ने अनेक विद्यों और विद्यार्थियों को प्रशिक्षण देकर आयुर्वेद के शुद्ध सिद्धांतों, नैतिक चिकित्सा एवं करुणा भाव से उपचार की प्रेरणा दी। उनके लिए चिकित्सा एक सेवा और साधना थी। आज भी उनके विचार, शिष्याएं और उपचार पद्धतियाँ अनेक शिष्य और संस्थानों के माध्यम से जीवित है। उनका जीवन आयुर्वेद की निस्वार्थ सेवा का प्रेरणादायी आदर्श है।
येते? हॅलो, माझा आवाज येत आहे?
हो सर.
हां. नमस्कार. सगळ्या श्रोत्यांना माझा सप्रेम नमस्कार. आजचे जे प्रमुख अतिथी वक्ते आहे त्यांचं मी आज संक्षिप्त परिचय करू पाहत आहे. तर मी त्याचं शॉर्ट इंट्रोडक्शन मी आज तुम्हाला देणार है। मुझे अत्यंत प्रसन्नता हो रही है कि आज हमारे विशिष्ट अतिथि वक्ता डॉक्टर रेणु भरत राठी का परिचय मैं करा रहा हूँ। डॉक्टर रेणु राठी मैडम महात्मा गांधी आयुर्वेद कॉलेज हॉस्पिटल रिसर्च सेंटर सालोड हीरापुर दत्ता मेघ इंस्टीट्यूट ऑफ हायर एजुकेशन DMIHR वर्धा महाराष्ट्र भारत में कौमारवृत्ति विभाग की प्रोफेसर एवं विभाग अध्यक्ष एवं PhD मार्गदर्शक है। उन्हें स्नातक स्तर पर 24 वर्षों से तथा स्नातकोत्तर एवं PhD मार्गदर्शन में 9 वर्षों का समृद्ध शिक्षण का अनुभव प्राप्त है। अब तक के 50 से अधिक MD और 20 से अधिक PhD शोधार्थियों को सफलतापूर्वक मार्गदर्शक प्रदान कर चुके हैं। डॉक्टर राठी हेल्थ साइंसेस एजुकेशन HSET की विशेषज्ञ है तथा राष्ट्रीय भारतीय चिकित्सा पद्धति आयोग NCSM द्वारा आयुर्वेद यूनानी एवं सिद्ध विषयों में मान्यता प्राप्त पर्यवेक्षक के रूप में नामांकित है। उन्होंने वर्ष 1998 में NIA जयपुर नेशनल इंस्टीट्यूट ऑफ आयुर्वेदा जयपुर से कौमारवृत्ति विभाग में MD की उपाधि प्राप्त की। इसके अतिरिक्त उन्होंने बायोइथिक्स स्वास्थ्य विज्ञान शिक्षा क्लिनिकल रिसर्च एवं योग में विशेष प्रशिक्षण प्राप्त किया। उनका शोध कार्य मुख्यतः बाल पंचकर्म विकासात्मक विकलांग कुपोषण एवं व्यावहारिक मनोरोग जैसे क्षेत्रों पर केंद्रित है। डॉक्टर राठी अब तक के 60 से अधिक शोध परियोजनाओं को पूर्ण कर चुके हैं, जिनमें प्रोबायोटिक हनी डी एडिक्शन तथा सोनाप्राशन पर आधारित वित्त पोषित अध्ययन भी शामिल है। उनके नाम 220 से अधिक शोध प्रकाशित है, जिनमें 100 से अधिक स्कोपस पबमेड एवं वेब ऑफ साइंस में अनुक्रमित है। इनके गूगल स्कॉलर पर 560 तथा रिसर्च गेट पर 640 उद्धरण साइटेशंस है। आयुर्वेद बाल चिकित्सा के क्षेत्र में उनके योगदान को व्यापक मान्यता प्राप्त है। उन्होंने बाल पंचकर्मा पर एक पुस्तक, रिसर्च मेथोडोलॉजी एवं बायोस्टैटिस्टिक्स पर 2 ई-बुक्स, 16 पुस्तक अध्ययनों में विशेष योगदान तथा 16 कॉपीराइट प्राप्त किए हैं। वे 65 से अधिक राष्ट्रीय एवं अंतर्राष्ट्रीय मंचों पर अध्यक्षता एवं वक्तव्य दे चुके हैं। डॉक्टर राठी ने अब तक 200 से अधिक स्वास्थ्य विज्ञान शिक्षकों को स्वास्थ्य शिक्षा पद्धतियों में प्रशिक्षित किया है और वे विभिन्न संस्थाओं में जर्नल्स में मेंटर, रिव्यूअर एवं सलाहकार के रूप में सक्रिय है। उनका कार्य आयुर्वेदिक शिक्षा, नैदानिक अभ्यास, अनुसंधान को आगे बढ़ाने के प्रति गहरी प्रतिबद्धता को दर्शाता है। आप उन्हें इंस्टाग्राम पे डॉक्टर रेणु राठी और साइंटिफिक राइटिंग मेंटर, फेसबुक पे बालांकुर, यूट्यूब में डॉक्टर रेणु राठी 2459 और लिंक्डइन में फॉलो कर सकते हैं। मैं सहर्ष स्वागत करता हूँ डॉक्टर रेणु भरत राठी मैडम का कि आपका परिचय और संक्षिप्त मैंने आपका किया है और हम आतुर है आपने आपका व्याख्यान जल्दी ही चालू करिए। थैंक यू मैडम।
धन्यवाद। श्री धन्वंतरे नमः, श्री गुरुवेभ्यो नमः, गुरुवे नमः। मैं सभी को, गणमान्य व्यक्तियों और सभी जो ज्वाइन हुए हैं और यूट्यूब से जो ज्वाइन होने वाले हैं, उन सभी को मेरा नमस्कार। हम आदरणीय प्रता जोशी सर के जो अभी ये जो व्याख्यान माला है, चर्चा सत्र जो है वीकेंड पर का, उसमें सभी का तहे दिल से स्वागत करती हूँ और मेरा पंचकम के जो एक मेरा छोटा सा वक्तव्य है वो मैं अभी शुरू करना चाहती हूँ। आई होप माय स्क्रीन इज विजिबल। प्रैक्टिकल एप्लीकेशंस ऑफ बाल पंचकर्मा। हमें कई बार ऐसा होता है कि बहुत सारी चीजें पता होती है, लेकिन व्हेन इट कम्स टू इम्प्लीमेंटेशन we are lacking a little bit. So it's a just reminder, we all are Vaidya and we all know everything. Just the thing is that a gentle reminder to get the clarity in practical applications, particularly in children. So the learning objectives are at the end of the lecture, learners will be able to comprehend practical uses of Abhyanga, that is Bahya Snehan, then Abhyantar Snehapan, Svedan, those are the Purva Karma, including Rukshan and Purva Karma all, and then Panchakam in children. But we are covering in 1 hour so many things. So all are just a recap and a short summary sort of. Then we will learn about indications, contraindications, why the selection of the patient and material is very important, understand precautions, prevention of Vyapad and its treatment, know the types of Swedan and practical utility in all age groups with significance in the Indian as well as global health market, that is Hub and Expo. Then demonstrate the practical utility of Vaman and Sadhu Vaman, Virechan, Nasya and Rakta Mokshan in children. Develop a niche to start a medical tourism or global healthcare journey, tips and tactics with a take-home message. So the contents will be introduction, rationale, benefits, mechanism of action, formulation use, then modalities with different interventions, take-home message for the execution of all Panchakarma in children. Scope of Bal Panchakarma, it is a wide scope having biopurification, detoxification, curative purposes, preventive, rejuvenation, preparation for surgery to improve GC, that is general condition, because many times in RBSK, we are not, as a surgeon, we are dealing in Ayurveda, particularly in Balro, but sorry, but we are making their general condition improved with the help of Snehan Swedan or Snehapan to get the weight gain or to get the proper suitability of the body to face the GA, general anesthesia, and other as a pre-anesthesia checkup, we are giving them fitness with the help of Snehan Swedan. Then rehabilitation, age variation in different Panchakam procedures, but as per Yukti and need we can do in customized or individualized experiences. So Abhyanga, mainly it is widely known as very commonest, and we can see so many resort places where only Abhyanga and Swedan, which are going on instead of whole Panchakam. So it is widely used all over globe. अभ्यंगम आचरित नित्यम सजरा श्रम वाहतः दृष्टि प्रसाद पुष्टयाहु आयुः स्वप्न सुवक्त त्वचा and दार्ढ्यकृत, all are rejuvenation purposes or pre procedures, or as a main procedure also Abhyanga has been used. In Abhyanga has been already narrated by all acharyas in Dincharya for health maintenance, treatment of certain diseases, and a part of pre-therapeutic procedures in Panchakam. Many neurological diseases have no permanent cure and are becoming a global issue. So in cases of genetic, autoimmune, metabolic, and hereditary disorders, multidisciplinary approach is essential, and Abhyanga is one of the main modalities where we can deal it, we can use it in all kinds of diseases in children, and irrespective of age, we can use it in all medical also, genetic cases also, and each and every, where only the thing is that contraindication is that body must not have arm. So whenever there is Amavastha, we will see in detail the contraindication as well. So Panchakam can do wonders in treating them by enhancing channel clearance as well as cellular level circulation, because it improves the molecular level or cellular level circulation with the help of Rukshan, that is Utsadan, Udvartan, Udgarshan. These three things are more inclined to give these effects, cellular level circulation, than Abhyanga. So with the supply of nutrients, because we are choosing those material which is directly needful to the body, and as a customized experience or individualized experience, we can choose the proper selection of medicine as per the need of the patient, and fluids with the necessary shaman, chikitsa and physiotherapy. As children have kapha dominance, Rukshan should be included. So main purpose is that we, as Nana was always saying that we need to check whether patient is like apatarpan kruta or santarpan kruta. So we need to do, whenever there is a kapavastha more, then we need to do the rukshanavastha, that is apatarpan, and whenever there is a vat dominance, we have to do the uh, dominance is there, then we need to do santarpan. So Bruhan is again there. These kind of things are always comes in rejuvenation. That is Bruhan, and we have so many variety of formulations to use as a oil based or ghrita based snehapan instead of vasa and majja, because these are very rarely used by as a snehapan. But tail and ghrita, especially tail, are so much popular, and even we can give in as an internal administration as well. So many Kolkulathadi Talapudichal or Rasna Pradhamanasya or Udvartan, Patrapotli, Sasneha Nirovasti, all these procedures comes under Rukshan, and especially Shiropichu, Shirodhara, Tailadhara, Nasya, that is Bruhan Tail Nasya, Shashti Shali Pendasvet, Matra Basti or Anuvasan or Sneha Basti. These all procedures are comes under Bruhan procedures. So Abhyanga mainly benefits we all know. So without wasting much time and much giving much emphasis to Abhyanga only, we will proceed further. That is with Sneha and without Sneha, which is when there is a more Vatavastha, Vata Ulbanavastha, we have to focus on Sneha. And if there is a little bit Kapha, then we have to, without Sneha also we can do Abhyanga. For example, in summer season, if we need to do the neonatal massage, we can apply like talcum powder, and we can do massage with the help of talcum powder only instead of using oil, because in summer season and kapha we should not use oil instead of that, because no child also don't like that chip and that oiliness. So we can use that, and we can use so many other things which are not as a without sneha. So as per Yukti, we can modify the procedure, we can modify the material, and give the proper soothing experience to child. Prerequisites and method. Selection of oil is very important. Therapists must be skilled and trained in handling infants, because sometimes if they are not trained in handling, they may get the fall of infant or younger child. So they must be trained in handling the infants or younger child. Ensure the absence of any infection, because infection may get spurred due to massage. So we need to take care that no absence of any infection. Then temperature must be checked to avoid burns. Then the ambience must be playful and light, with calm and pleasant music on to make the child comfortable, because any child is so much frightened for any kind of procedure. So we need to ensure that these all are very soothing, very comfortable, very likely to go ahead, instead of because whenever in the ambience of as a hospital, children gets frightened and they do not like the ambience of hospital. So instead of that, we have to make the playful, and the colors, the decoding, and that the pictures are so much cartoon type or so much childish way, so that they can get acquainted easily and do not cry continuously. Hands must be soft and no equipment or gloves, because sometimes therapists use gloves, and they children especially don't like the gloves touch. So they require and they like only the human touch, not any artificial touch. So pressure should be light and equal. Knowledge of muscle origin and insertion, direction of massage, and knowledge of anatomy is must to therapist. Many times it happens that, for the sake of just starting the resort kind of only Snensveden, many of therapists don't know the anatomy of the muscles and the insertion origin and the direction, and they are just doingly just kind of uh, like as a professional things, but the Ayurved part is very much lacking in that. So we need to take care of that. Contradiction, amavastha, especially fever, chardi, atisar, pravahika, dehydration, because dehydration, any procedure, if baby is for poisoning or bite or any emergency condition, why it is contraindicated? because of Tridoshavastha, in inclusion of Tridoshavastha. So if Tridosha are dominant, we can't do any kind of Panchakam, especially Snehan. Because any Amavastha or Tridosha Ulbanavastha, we should not do any kind of Panchakam. But when there is little bit Niramavastha, no much Amavastha is there, we can do Panchakam. Especially Kapha Pittaj Vyadhis, we should avoid Snehan or particularly Snehapan, because already Kapha dominance is there, so Snehapan must be. But if we have to do the Shodhan, then for any kind of dominance, we can give as per Yukti. We have to calculate the dose of the Snehapan, and as per the disease need, as per the patient's liking, and as per the feasibility, we have to choose the proper material and give it with tapering, with increasing doses of Snehapan to give to start Pradhan Karma. So drawbacks of Abhyanga, many times, sometimes infection may get spurt or allergy may go if the material has been not checked, or if it is not been prepared with good herbs, and herbs are contaminated, then it may rarely cause of allergy. And critical babies, if already babies are having Amavastha and still we are doing Snehan on those babies, so we need to avoid such thing. Skin injury may happen if the injury of the therapist have very rough skin, or the skin injury is already there on the baby's body parts. And if toxicity, toxic the topical products may have toxic effects if the skin is much sensitive and highly permeable. So in preterm especially, or in high risk babies, we should avoid such harsh oils, and we need to check the sensitivity, because only the problem comes in only preterm or SFD babies, where they are very much sensitive. We have to use the proper direction of massage, so that taking care of the origin and insertion of the muscles, and avoid technicalities like a playful approach must be there, and avoid the so much rubbing at umbilical point, because it's a Jyotir Sthan, that is solar plexus is there, and we should avoid so much directly focusing on umbilicus properly. Instead of that, we have to give the circular massage peripheral to the umbilicus. This is the directions, the pictorial images of directions of Abhyanga. So we need to take care as per the muscles origin and insertion. Direction of massage, particularly Abhyanga, should be performed in Anulom Gati, and whenever there is Udvartan, Udgarshan, then all these Rukshan kind of procedures, we have to do the Pratilom Gati. And for topical action, oil action, and modalities, there are so many modalities of Snehan, Bahya Snehan. We can do Shiropichu, Shirodhara, then Pratisaran, or external bastis, and so many ways we have to provide the Sneha supplement inside the body. Timings, as per timings, are not should be not adopted as only 30 to 45 minutes. As adult, we have to implement in adult, but in children we have to increase the timings from day 1 to day 7. Slowly we need to increase the timing to get the acquaintation to the child, and baby must be comfortable, not so much cryful. So choosing the right position and duration is also important, because the therapist back should be straight to feel comfortable, and duration frequency according to Prakriti. If Vata dominant Prakriti is there, then we can apply daily administration of Bahya Snehan. When Pitta dominance is there, we have to do alternate day, and if Kapha dominance is there, once in 4 days or twice in a week, we can suggest. These are the positions: sitting, supine, left lateral, prone, right lateral, supine, and sitting. We all know already. So phases of Abhyanga, as per strokes, as per need, as per the dominance and severity of the illness, we have to do the Abhyanga. Caution while using oil, particularly we can check the oil, and then especially in sensitive children. Otherwise, already Vatahar herbs are there, and they are very much safe. So virtues of Abhyanga as a daily regimen, as a as a Jarahara, as a Shramahara, as a Vatahara, Drishti Prasadan, then Pushtikar, Ayushya, then Swapnakara, and that is Nidrakara, and Tokadardhakara, Klesha Saha, Abhihitam, then Kapavata, Nirodhan, and Varna Balapradam. Mode of action on mind and body, strength, opening of channels, beauty purposes, and so many benefits are there as we give as a nourishing, especially on sensory organs. And skin is almost sensory organ, and the main carrier to means वात का स्थान है त्वचा. So we need to emphasis and rejuvenate our body with the help of Snehan. Mode of action as per modern science, route of administration, and it's a transdermal penetration of essential oils. We can use aroma oil as well, or we can mix the Vata, Ayurvedic herb Siddha oil with aroma oil, and with the help of combo, we can use, because many times some children, I remember 2 to 3 cases in my practice, patients, especially of one is 13, one was 13-year-old, and another was, and both are girls, 3 to 4 patients, but mainly I remember only 2 girls who are strictly denied to get the Snehan done because of smell of the oil. They have very much sensitivity. They didn't like the smell of the oil, and they didn't ready to carry forward the further procedures, or on day one only they have strictly denied, and I have to stop with the help, with their due respect, and the patient ke upar, means we should not force them. For the sake of our benefits, we have to search the another modalities, so that we can serve them better, and they also get ready to continue the Ayurveda treatment. Otherwise, they will seek the another doctor, and they will never come us. So we need to support the patient's faith system, belief system, and their liking as well. So elasticity, plasticity, and mobility of soft tissue augments well baby clinic. There is a trend of well baby clinic. So below 5 years, there is a trend, and so we need to take care of such, especially snails within things which are the important modalities in children. As per the growth and development is continuously going on, we need to focus on their such elasticity, because flexibility and muscle power, muscle tone, all gets improved with the help of this oil massage, and body gets rejuvenated, and even happy hormone gets released, and baby gets very smooth sleep, and sound sleep. There are so many case studies I have mentioned in my book Bal Panchakarma from A to Z. It's a guide, and it is available on all this Amazon and Flipkart and everywhere. So case studies, particularly Gritpan of Bruhan Dravyas, increase weight gain and oral rejuvenation, especially in PM, Karshya, Balchosh, or all other apatarpan kruta vyadhis. We can give the internal administration of Bruhan Dravyas, Bruhan, even Grita or Taila. And even like Dhanvantar 101, Avrutta Tel are there, which we can give the internal administration for Vata diseases, Vata dominant diseases, as well as if baby is having SFD, LBW, or low birth weight, or babies having other comorbidities. So as we give Pratimarshanasya in a very small quantity on daily basis, in the same way we need to give such Avrutta Tel 101, Dhanvantara 101, then Kshirbala Tel 101. We have to give as a daily basis in a small quantity, because these are already most potented as a 101 Avrutta. So no need to give much dose. They are acting as a, in limited dose also, they are acting very well. And already children don't like to take such oil or Ghrita, Kalpa. So this is the very best and fantastic idea that we can give Avrutta Tel, because dose gets drastically lower down. The Snehapan in cerebral palsy, hypothyroidism, Down syndrome babies, to correct hypotonia and IQ as well, because it helps in When we do in Shiropichu, Shirobhyanga, Shirodhara, they are increasing IQ due to increase in brain circulation. So Snehapan in Mutrakrucha as a Vicharna Sneha, whenever there is a Mutrakrucha or Mutrashmari with Shita Jala Avagahan, we can increase the duration of pain, the pain Vegavastha, Shula Vegavastha, due to this Vicharna Sneha continuously on daily basis. And whenever there is a Vegavastha, we have to give such like half katori or 3/4 katori instantly as a sadhya whenever there is a Vegavastha. But when the already known case of Ashmari or known case of recurrent UTI infection, we can increase the timing of this duration of attacks due to this Snehapan only. So with the help of Adarsha Manoshadis, we can directly relieve such ailments very well without operation. So Taila Snehapan in chronic Vatach case, because nowadays after COVID also, we can see in our practice there are so many Vatach case patients, dry cough patients who are continuously coming, and despite taking 10 to 10 bottles of cough syrup, they are not getting relief in Vatach case. So instead of these, we can just add the Taila Snehapan, that is Til Tel Snehapan, Koshna Til Tel Snehapan with Sendho. So whenever there is a continuous bouts of cough, which is very irritating one, and especially in night, so that we can directly give as a home made home first aid, we can convey to parents that give it whenever there is a continuous bout of cough. So Taila Snehapan is very good, like 5 to 10 ml or 15 ml. Instantly, we can give Kushna Snehapan, Til with Sendo, and it gets the relief. We can see that the relief in Vatachkas. Even we can do such in geriatric patient as well, because geriatric and pediatric, the treatment modalities are near about same. So bronchial asthma, then tamak shwas, all such cases, we can use this Taila Snehapan very well. And on this topic only, I have did my study, another study as a pilot, 12 patient study, and I found that I have published that article also. It gives fantastic result, and it's very easy because तेल हर एक के घर में होता है, और डायरेक्टली जो भी तेल हम खाते हैं वो डायरेक्टली अगर गर्म करके गुनगुना करके अगर हमने विथ स्नेहा with Sendho agar diya, so directly we can get the results. So Snehapan in Pandu, Kamla, chronic Rakta Pitta or Vatrakta even means Pitta dominance. Already we know that Sneha is fantastic, especially Ghritakal are very fantastic. And in Jirna Jwaravastha also, all Acharya have given preferences to give medicated Ghritakal. There are multiple case papers, research papers on Snehapan, Bahya Snehan, and another so many modalities like Purva Karma, Pradhan Karma, Pashat Karma. All these modalities have full of coverage, but the thing is that we are still lacking the index papers, which are very quality one, PubMed, and there are so many papers, but maximum of they are review and not as RCT. So there I want to request all of you that we need to increase our publication for RCT purposes, or a pilot at least, not as a case report and or not as a review. So whatever we need to show to globe, to all such, especially allopathy people, that we have these success stories with the help of pilot studies or RCTs, so that only case report will not give, means it's we can see the hierarchy, and there is a very less importance to case report instead of RCT. So we need to do such efforts in our routine practice, and whatever data we have to convert it into RCT and compare it with control, so that people, especially globe and allopathy people, get that evidence. So evidence-based Panchakarma will be the futuristic plan to publicize our Ayurveda, and particularly Panchakarma. So case studies in general, Samprapti Ghatak, we can see all these Nidan Panchak and all Marga, and especially, but it is in general only. So case based, we can see the difference. Bruhan Talapodichil, we have to just add oil and give that Arabian kind of Shiro Pichu, and we need to tie it. But many times ADHD and autism patients do not keep it. They directly straightforwardly remove the Shiropichu and they do not keep. Even they are continuously crying whenever Shirodhara is going on. But slowly, if we give daily bombarding and daily mental preparedness, then they will get ready and slowly they will do it very well. So in Rukshan Talapodichil, we have to apply such a Rasna or Shatapushpa or such powder, mixed kanji, so that semi-solid paste will be there, and we need to apply whenever there is a kaphavastha, kafulbanavastha. And whenever there is a Vat Pradhanya, then we need to do the medicated oil, Shiropichu. There are so many products available in the market, particularly shampoo, then cream, and so many things are there. And many times, few cases coming to our OPD that they do not get suited, and they developed rash. And so the best thing is that no such powder or perfume or so much aroma must not be there in any such so much chemicals, or it's very, because child's skin, especially newborn and infant skin, is so much tender and very sensitive. So we need to avoid such harsh chemicals based products. Instead of that, we can rely on our turmeric powder with navnitam or narikil, that is coconut oil, or ghee, or even glycerin soap, or neutral soap with alkaline pH. Action and benefits, we know that Medhya, Shita Prashaman, Balya, Bruhan, Dedosh, we already know everything. And this is the local and central mechanism of Abhyanga. Give abundant sensory inputs to cortical and other centers in CNS. That's why Abhyanga, as a directly, because skin is covered all over across the body, so it gets directly penetrated and absorbs very well and pacify the bath. Action and benefits, we can see our dye system is still there, and our grandmother, even mother, for daughter-in-law's baby, that is nati, we all grandmothers do this kind of massage, and it's a health promotive, protective, and emotional well-being, bonding. So it all increases, and Abhyanga is very good with having so many benefits. So we need to select the oil as per the prakriti, as per the sensitivity of a child, and as per the individualized approach experience. We need to choose the oil as per feasibility as well. So formulations are so many, and even we can do Suryakar Praptam. That is, we can directly medicate it, and we have to keep it in sunlight so that vitamin D also gets involved in that oil, and it will be enriched, because many times we need to give the prescription of vitamin D3 drop after each and every delivery as a trend now, because vitamin D having so many benefits in as a protective, as a preventive. So we need to just apply this concept of Surya Paki, we can say, and get the added benefits of vitamin D3. So properties of Abhyanga and SSPS, we need to check that heat, touch, and pressure. By these three mechanisms, we will see that this mechanism of action is very well facilitated within CNS and CVS. So the take-home message is scope for clinical studies in neonates. Particularly, they I check that those such especially neonatal massages research papers are very few, and we need to focus on these things, and we have to prove that how, because allopathy files, there are directly written that no kajal, no massage, no any such putting oil in on nose and ears. So directly everything there is a deny. So we need to create evidence and publish it the data, so that they can directly have evidence. Before just we are claiming that no Ayurveda is very good, no. So all this Karna Puran, Nasya, and this massage Abhyanga are very good, everyone is knowing, but we don't have that quality evidences. So with the help of publication, we can do so. Now start with the Swedan. There are so many varieties of Swedan types: Hasta, Pada, Hasta, Pata Swed, Nadi Swed, Pinda Swed, Putli Swed, Upanaha, Parishek, Avgahan, then Murdhakriya, Shiropichu, Shirodhara, Shirobasti, and so many ways we can provide Svedan, that is hot fomentation, to as per the need and as per the dominance of the Kapha and Vata. So here Kanjidhara, Pind and Patrapotli Svedan, even so many variety of changes and modalities we can modify and do as per the need of the baby. Parishek Svedan, Shashtikshali Pinda Swed, and this is the mechanism of action, properties of Abhyang and SSPS based on these Ushna and Ushna properties as well as Snigdha properties. So that directly Kapha and wherever the dominance is Vat dominance, we have to choose as per the select the proper type of Svedan. So mainly mechanism of action is it directly gets penetrated in the skin like sensories and relieves muscle spasm, rigidity, and improves the flexibility and muscle tone, muscle power, and provides pain relief as well. Shirodhara, we know that there are so many benefits and vibration and the distance and the flow and that hot flow, which is directly giving the vibration and continuously that oil based. It facilitates the penetration as well as supply circulation of the brain. So it gives the calmness, gives the good sleep, and improve the IQ and cognitive power. Pharmacokinetics and pharmacodynamics, absorption based, distribution based, metabolism based, and excretion based. It is very good and providing good, fantastic reliefs. And pharmacodynamics, Sweden dilates blood vessels, that is vasodilatation, increases circulation and opens pores and facilitates the removal of toxin. Means supplement of nutrients with the help of Snehan and removal of the excretion of toxins, that is arm, from the pores due to vasodilatation. So it acts as a therapeutic efficacy also and as well as pre-procedure as well. So we will proceed to Vaman. Why Vaman is important in especially children? Because children having more kapha dominance, and that's why it in Vaman is especially useful in relieving kapha dominance and cleanses excess kapha, detoxifies the body and increase the immunity, and even prevents disease recurrence. If we are talking about RRTI, or if we are talking about any kind of skin ailments which are very much irritant and coming again and again, so and if stolla is there, or if high medavasta or other dominance of cough is there, we can do Vaman very easily. But as per already Acharya told us that not to do within 6 years of age. But in neonatal condition also, Acharya convinced that we have to do Sadhya Vaman on day one only, just after birth. So we get two contrary opinions. So as per Yukti, we have to facilitate. Even in my practice, I have I have dared to treat it in chronic case of Kafach Kas and pneumonia, particularly when there was no fever. I have did that part and I got the continuous ronchi where it directly turns to without no adventitious sounds. So we need to keep faith in our science and do try, and wherever and whenever we get the evidence, we need to publish. So Sadhya Madanfal Churna with either milk or Sandho or Koshnajal, instead of all adding Vacha, Eshtimadu and everything, just in Sadhya Vaman, when to do Sadhya Vaman? That is the important question. In each and every case, we can't do Sadhya Vaman. Sadhya Vaman is only applicable whenever there is a Ulbanavastha. That is whenever nausea is present. Then only we have to do the Sadhya thing. Otherwise, we have to do the scientific Vaman only. That is scientific meaning to do the continuously increasing order Snehapan and then Purva Karma, Snehan, Swadan and everything, and Kapha dominant diet, and thereafter we have to give Vaman. So this is scientific Vaman, and when Sadhya Vaman, there is a Ulbanavastha, already nausea is there. So patient do not need any kind of Snehapan because already nausea is there. So we have to do directly Sadhya Vaman or with the help of Madanfal Churna, either milk or Sandho and then Koshnajal. Then we need to check the Vaman Vaman Samyak Yoga with the help of Vegiki, Maniki, Siddhiki, Avastha. Then Dhumpan we need to give with the help of Haridra, certain sando and all such herbs we have to add and get roll of it, and Dhumavarti should be prepared and give the Dhumapan to subside the residual kapha. And also I learned in my practice with the help of Nana's one important quotation that Sitopaladi acts as a ORS. So whenever in child already Karshanavastha they can't bear. So all panchakarmas are little bit Karshankar. They are giving a little bit pain, and they are getting rahas of bala. So in such condition, if we are giving just after Vaman, we are giving them as a 1 gram instant dose of Sitopaladi, it not only helps the directly rehydration purposes, but also gives the residual doshas, residual kapha relief. And third thing, as a directly give the boost in Agni, because drastically post Vaman Agni gets very much mandya. So we need to increase it again, because growth and development is going on, and we can't be so harsh in giving 3 days this post Pashat Karma Sansajan Kram. Instead of that, if we are giving directly Sitopaladi and such things, so we have to start only the full meal slowly with the in second day only, instead of day 4, as we do in adults. So Mrudu and we have already discussed, even instead of giving them the kind of kapha ulban diet like breakfast, we can give directly milk and parleji, because biscuits are very much especially parleji, not others, because everything as nowadays atta biscuits are also available. But whatever, instead of you using maida biscuits, we have to use atta biscuits, so that they can directly provide as a food, and they are sweet. So it's a kapha ahar, and it is not going to digest. We are directly removing them, so we can use of that. And as a kapha ulban breakfast, we can give milk and parleji, because in Sadhya Vaman particularly, they are facing nausea, and they are not ready to have any breakfast, or eat any breakfast. So we have to just modify their diet and as per the Yukti Praman, and we can go ahead. So it is very useful in RRTI, bronchial asthma, amla pitta, thaulya, skin disease, and so many other variety of diseases where kapha is dominant, not arm. Vaman indications: Shwas, Madhumeha, Unmad, Kushta, Rakta Pitta, Stolya, Granthi, Gulma, and other Kapha Pitta Prakopak Vadis. And contraindications are acute peptic ulcer, this Shudrika and Pipasa, and this, so other things, especially Hrudray Rog and pregnancy. So Samyak Veg, Ayog Veg, Ayog and Ati Yog and Vyapat. So as per the we have to check that for as a checklist, we need to check that each and every karma must be properly executed well, so that no any we can prevent vyapadas, complications. If we are selecting the proper proper medicine material and proper patient. So materials are two, like patient selection as well as Aushad selection. This we have to put such some time. We have to imply some time in selection, so that the further things, Pradhan Karma and Pashat Karma, will be easy. So we need to give some time in selection, in planning, in exam. If the plan is well, we can go ahead very well without any complications. Here another article is that Vaman Vyapad in children. So I have it's a case series, and I have mentioned 4 different cases in which how did I face the Vyapadas and how did I overcome them. But as time is short, you can directly go through this article. So case studies: respiratory disease, skin diseases, gastrointestinal and metabolic diseases, we can see so many diseases, especially Shvitra and all kapha dominant and pitta dominant diseases, we can do Vaman. Now come to the Virechan part, not ideal because below the age of 16, but wherever and whenever there is a baby or patients, younger children, or especially contraindication of age-wise contraindication is there for Virechan, we can do Basti. Basti is very safe and we can do instead of Virechan. So Virechan directly, there is a why we should, Acharya have told contraindicated in using below 16 years of age Virechan because of dehydration. Because there is a high chances if they are not properly executed or not, they are directly taking at home their medicine of Virechan Aushad, they may land up into the dehydration. So instead of that, we have to choose such younger children age group or sensitive in, children or pitta dominant, because their koshta is mrudu. So we need to take care of Agni, koshta, pragvay, their disease, their avastha, their everything. And then accordingly, we need to plan well so that there will be no any chances of creation of Vyapadas. So dose is also important as per the Prakriti and as per the age of the patient and weight of the patient. We need to calculate the dose of the any yogas where whenever like any panchakarma dose is very important, and formulations yogas are important, and we need to find means use properly in making the plan calculation. Do not haste in doing that and earning. Instead of that, because any one case gets bad or gets our or in Vyapada condition, there will be defame. So defame gets very spreaded very fast instead of fame. Fame gets very slowly, but defame gets very fast. So we need to take care of that, and we should ensure, because this age is very much younger children or age group, childhood age is at most very critical, and it is a very sensitive one. So we need to be cautious enough to choosing whenever we choose any kalpa, we must be ensure again and again, and then we need to calculate the proper doses and give it. Now come to the point of Basti. Nana always say that Basti घ्यावा, Basti द्यावा, Basti जीवाचा विसावा. So I remembered that when I was in Malegaon, one case of nephrotic syndrome came to that day, and when I was direct, because I was just passed out from NI, and I very well know that nephrotic syndrome has been treated by steroid only. So I told to Nana that आता काय करायचं याचं, म्हणजे कसं ट्रीट करायचं आपण, आणि ते पण पंचकर्मानं. तर नाना डायरेक्टली बोलले की व्हेनेवर देर इज ए जेव्हा पण किडनीचा जो प्रॉब्लेम असतो तो नेहमी वमनाने चांगला ठीक होतो. तर कारण आमाशय आणि ही किडनी हे जवळपास स्ट्रक्चर वाईज आणि त्यांच्या म्हणजे जे मेन ज्याच्यापासून ते बनलंय, तर ते मेनली कफाचं स्थान आहे, आणि त्याच्यामुळे त्याला आपण वमनाने ठीक करायला पाहिजे. तर त्यावेळेस आम्ही एज कमी होता, त्याच्यामुळे आम्ही काही खूप असं सायंटिफिक वमनाच्या मागे न लागता आम्ही डायरेक्टली सद्य वमन दिलं, इंड्यूस केलं थोडंसं नॉसिया, अँड आम्ही तिला वमन दिलं. पण नंतर ती पेशंट नंतर आमच्या फॉलोअपला नाही आली, पण म्हणून मला पूर्ण कळू नाही शकलं की काय रिझल्ट मिळाला आणि कितीपर्यंत तो सक्सेसफुल झाला. पण मला ते आठवतं की आपण कसं वेगळं, कारण आपल्या ह्याच्यात नेफ्रोटिक सिंड्रोम आणि त्याची ट्रीटमेंट वमनाने असं कुठे लिहिलेलं नाहीये, कुठे मेन्शन नाहीये. तर जे पण डिसीज नवीन नवीन येत जातील, जसं कोविड नवीन आला, अजून बाकीचे डिसीज नवीन येत जात राहणार, तर त्यांच्या दृष्टीने आपण विचार करून दोषांची अवस्था काय आहे, त्याचं स्थान काय आहे, त्याची अवस्था काय आहे, त्याची सिव्हिरिटी काय आहे, त्याचं एज काय आहे, या सगळ्या प्रकृती काय आहे, सगळ्या गोष्टींना व्यवस्थित पाहून जर आपण निर्णय घेतला आणि प्लॅनिंग व्यवस्थित केलं, तर नक्कीच आपल्याला यश मिळू शकेल. आणि ती प्लॅनिंग जर व्यवस्थित असेल तर नो डाऊट सक्सेस विल बी देअर. So whenever there is a difficulty in giving virechan, we can do as alternative way. We have to give basti. As Acharya have mentioned, this very large doses in basti matra, especially nirva, we can reduce this, modify the doses as mentioned by Acharya as per the yukti praman, as per the body's feasibility, need, age, and severity of the disease. So in general, we can say that Dashmul, whenever there is a Dashmul Kashay, we have to give age into, say suppose age is 5 years. So 5 into 20. So when tail we are adding, we need to give age into 10. When we are adding madhu in basti preparation, we can add age into 10. And then dhanyamla or kanji or mounds rasa or all these things we can add into 5 ml and kalka 10 gram. So accordingly we can make, and as per the kashay quantity we can reduce as per the avastha and severity of the patient. Nasya, Marshanasya not advised below 6 years, but it is for Marsha only. But for Pratimarshanasya, it is well advisable and executable from day one, that is from breastfeeding day, in even breastfeeding also, from neonatal condition to directly geriatric and palliative condition also, we can give Pradhamanasya very well. Nasya yogas are as per selection of Nasya yogas whenever there is a particular kind of disease. So when there is a sinusitis, we can use Varunadi Kshira Ghrutam, or if we are using some different kind of formulation and if we are getting result, we can directly publish case report as well. Manduk Parniswaras and milk in autism and ADHD, Rasnadi Churnam as Pradhamanasya in Apasmar, because small we can modify the Churnanasya, Pradhamanasya by with the help of cone, paper cone. लाईक आपण जसं मेहंदीचं कोण बनवतो तसं एवढंसं प्रमाणात काही ग्रॅन्युल्स किंवा काही कण फक्त पावडरचे, आणि ते पण एकदम कपड छान करून एकदम बारीक, एकदम जास्त मेशचं आपण जर 300 पर्यंतची मेशचं जर बारीक ठेवलं रासनादी चूर्ण, ते जर आपण एकदम फुंकर घालून कागदातल्या कोणामधनं डायरेक्टली टाकली तर ते नासाही श्वसोद्वारम म्हणून आपण डायरेक्टली त्याला अपस्मारचा वेग सुद्धा आपण कमी करू शकतो. शिरबला तेल नस्य and internal स्नेहपान in अर्दित. Raktamokshan, as Raktamokshan is a very frightened one in children, so we can, instead of Siravedan, we can use Jalokavacharan, which is the preferred mode of bloodletting in children. So Prachan we can do in particular few cases, like in eczema, that is Vicharchika, or in psoriasis cases, we can do little bit Prachan. But Prachan is also very painful, and especially the incisions by blade, patient won't cooperate, and directly, if it is at most needful, we can tie the cloth, the handkerchief over their eyes and directly do it. Safety precautions must be important, and we need to do this SOP checklist and ethics. So every procedure must be followed with the ethics part. Written informed consent must be there. And before consent also, we have to prepare them, their mind preparation. We need to convey them the benefits of that procedure, की कसं या प्रोसिजरनी तुम्हाला तुमच्या बाळाला कसं बरं वाटेल, हे आधी कन्व्हिन्स जर केलं प्रॉपरली, तर मला नाही वाटत की कोणी नाही म्हणेल. पण एवढंच आहे की पेशंट आपल्याकडे बऱ्याचदा अॅक्यूट कंडिशन मध्ये नाही येत आणि भरपूर फिरून फारून आणि नंतर क्रॉनिक कंडिशन मध्ये येतात, जी की फार सुटेबल कंडिशन आहे पंचकर्मसाठी इन्स्टेड ऑफ न्यू अॅक्यूट. बट असं नाही की अॅक्यूट कंडिशन मध्ये किंवा इमर्जन्सी कंडिशन मध्ये आपण पंचकर्म करू शकत नाही, असं अजिबात नाहीये. आपण पंचकर्म अॅक्यूट मध्ये आणि इमर्जन्सी मध्ये सुद्धा करू शकतो. पण आपल्याला हे बघावं लागेल की खूप जर त्रिदोष अवस्था खूप जर वाढलेली असेल, सिव्हिअर कंडिशन मध्ये, आपण अशा क्रिटिकल कंडिशन मध्ये लहान बाळांना कुठलंही पंचकर्म, भलेही ते स्नेहन का होईना, ते द्यायला नको. कारण जेव्हा बॉडी क्रिटिकल फेज मध्ये जाते आणि त्यात एनी प्रोसिजर इज ऑलवेज just disturbing it, the body physiology as well, in body pathology. So we have to directly get it niramavastha, and thereafter we have to do mental preparedness, or we can just शमन थोडंसं दिल्यानंतर आपण अॅक्यूट कंडिशन मध्ये पण 1-2 दिवसांनी ते आपण पंचकर्म करू शकतो. Mental preparedness is utmost needful. Otherwise, patient, if they are not faithing or they are not trusting Ayurveda and Vaidya, then the patient won't continue again and again. So we need to create the patient-doctor relationship, that trust, that faith building in the our science, and give the proper results as well. So for results, for good outcome, we need to ensure the proper planning, proper execution, proper doses, and the selection of the medicine and drug and patient. Bowel must be cleared, keep watch on vitals, instructions to be followed by parents and patient. मला अजून एक आठवतं की नाना नेहमी म्हणायचे की असं कुठेच लिहिलेलं नाहीये की पूर्वरूपामध्ये वमनाच्या पूर्व कर्मामध्ये निरोबस्ती द्या. असं कुठेच लिहिलेलं नाहीये. पण जेव्हा मी प्रॅक्टिसला मालेगावला होती ॲज अ मेडिकल ऑफिसर म्हणून, आणि नाना तेव्हा बऱ्याचदा यायचे आणि माझ्याकडे ते एक माझ्या आजीवन मेमरीमध्ये एक स्मृतीमध्ये आहे नानांच्या हाताचं लिहिलेलं माझ्यासाठीचं एक एक्सपिरियन्स, की त्यांनी मला जे मी म्हटलं, की मला जायचंय आणि मला एक्सपिरियन्स लेटर हवंय. तर त्यांनी त्यांच्या हातांनी स्वतःनी संस्कृतमध्ये लिहिलेलं ते पत्र मी एकदम जीवापाड सांभाळून ठेवलंय आणि मला त्याचं खूप प्राउड आहे, की माझ्याकडे नानांचं पत्र आहे, जे की मला एक्सपिरियन्स लेटर म्हणून मिळालेलं आहे. तर त्यांनी असं सांगितलं होतं, की जेव्हा आपण वमन करतो आणि जर आपण वातानुलोमन प्रॉपरली केलं नाही, तर आपलं ते वमन व्यवस्थित होत नाही. तर मला ती गोष्ट नेहमी आत्ताही व्यवस्थित आठवते, की आपल्याला बॉवेल मस्ट बी क्लिअर्ड, कीप वॉच ऑन व्हायटल्स अँड इन्स्ट्रक्शन्स टू बी फॉलोड ऑफ पॅरेंट्स अँड पेशंट. जर आपण प्रॉपरली पेशंटला वेळ दिला, की तुम्ही हे सगळं व्यवस्थित करून घ्या. जसं डाएट पर्टिक्युलरली कफ उलबणं डाएट द्यावं लागतो आपल्याला वमनाच्या वेळेस, विरेचनाच्या वेळेस, त्याची वेळा पाळावी लागते. तर हे सगळ्या गोष्टी आपण जर पॅरेंट्सला व्यवस्थित सांगितल्या तर आणि त्याचे बेनिफिट्स अँड जर तुम्ही नाही केलं तसं तर त्याचे थोडेसे दुष्परिणाम, तर आपलं वमन चांगलं नाही होणार आणि आपण हे एकदाच करणार आहे. जेव्हा आपण असं व्यवस्थित सांगू त्यांना, त्यांना ते पटतं आणि त्यांच्या डिसीजसाठी, त्यांच्या बाळाच्या रोगाच्या मुक्ततेसाठी ते तयार होतात आणि ते आपण त्यांना आउटकम पण देऊ शकतो, जेव्हा की सगळं व्यवस्थित प्लॅनिंग असेल. तर keep ready all prerequisites and post-care equipment, their proper working medicines with a pleasant ambience and cooperation from paramedical staff as well. कारण ते जर ट्रेन नसेल पॅरामेडिकल स्टाफ तरी आपल्याला प्रॉब्लेम होतो. म्हणून जसं 4 चतुष्पाद जे सांगितलेत आचार्यांनी, त्या सगळ्या गोष्टी आपल्याला फिट अँड फाईन पाहिजे, तरच चांगला आउटकम पंचकर्माचा येतो. The summary: detoxification of Panchakarma is the skill of the physician to the child and disease specific modification with Yukti Praman to provide a customized or individualized disease preventing and disease relieving experience. Need to take care of dose calculation, prevent vapadas, maintain hydration and electrolyte balance with assurance counseling before execution. Panchakarma plays a significant role in Balrog Chikitsa. It is a research part to standardize these procedures as per known variations of doshadi to treat the above diseases globally. So any questions? I would love to answer them as per my Alpa Buddhi. Thank you all. Dr. Bhushan sir, over to you. Hello, Meshkar sir. Hello.
Recording in progress.
Any questions? I would love to answer them. Am I audible? Dr. Bhushan sir? Yeah. Anyone can moderate questions, but I can't see any questions in the chat. If you have any query, you can directly unmute and ask me.
Hello. Huh.
Unable to speak in chat, you can
Yes,
directly
madam.
hand raise.
Yes, madam. I am unable to speak, and now the speaker is unable. Uh, मैं सभी श्रोताओं को विनती चाहता हूँ कि अगर कुछ क्वेश्चंस हो तो मैडम से अभी आप क्वेश्चन आंसर सेशन में पूछ सकते हैं. एनी क्वेश्चंस रिगार्डिंग बालक पंचकर्मा, यू मे आस्क. So I think there are no questions from the audience and Shweta. So I very thankful Dr. Renu Renu Rathi madam for the good review and the uh, literature on the Bal Panchakarma and the practical application of the Bal Panchakarma, which is the new one to the all. So मैं मैडम का बहुत बहुत धन्यवाद देता हूँ और ये सेशन समाप्त हुआ ऐसा मैं जाहिर करता हूँ. मैम धन्यवाद.
Dhanyavad. Best wishes to everyone for their practice. Thank you.
Yes, मैम. Thank you, मैम.